Hi, esteemed viewers, ladies and gentlemen. Welcome to this episode of our podcast where we talk about health matters. Today, we'll be talking about menopause, and we have an esteemed guest here, Dr. Theodora. So, Dr. Theodora, welcome. Thanks for honoring this invitation. Can you introduce yourself to our listeners, please?
Hi, thanks, Ma. Thanks for inviting me. My name is Theodora, as you said, and I'm a GP trainee in the UK. I'm married and I have a couple of children. That's about me.
Brilliant. Thanks for that very brief and thorough introduction. So, let's delve straight into today's topic. Could you tell us what menopause means?
Yes. So menopause, speaking to the general public, not just the medical audience, would be a phase in the life of a woman where there is cessation of normal menstruation. So we know the normal pattern for female biology is that, you ovulate every month. So every month, I'll start with saying you have a finite number of eggs in your ovary from when you're born. And it's that number you use throughout your reproductive career. Every month, a surge of hormones and complex balances leads to the release of one or sometimes more eggs per ovary in anticipation for conception, fertilization and all that. And where conception does not happen, the body naturally sheds both the ovum, the egg, and your womb lining. And that happens month by month until you get to a point where your egg count has dwindled very much and you have very few eggs left. And, things start to wind down to the completion of your menstrual career. So when it completely ends, that's called menopause.
Okay. Right. So essentially, when a woman has exhausted all her eggs from her ovaries, is it? Yeah. At what age do women usually experience this menopause?
So it's a wide variety of ages, but the mean age for the UK population is 51. But it can start anywhere between 45 up till age 55. Some people even start earlier. There are a couple of factors that can affect, when you start or when you stop. But usually 51 is the mean age.
Great, thank you. And how can a woman tell? Are there changes in her body that she will notice and she'll begin to say, "Oh, maybe I'm in menopause." I can see your lovely daughter. Hello, hello, darling.
It's inevitable.
Yeah, yeah, exactly. I understand. So are there changes that a woman would, begin to notice in her body or her health that will make her, suspect or believe she's probably gone into menopause or she's approaching menopause?
Yes. So because of the biological changes that are happening in your body, those things play out in a couple of ways. So there are many symptoms surrounding it, and then the core of it will be the changes in your menstrual pattern. So changing from a regular, maybe 28 to 30, 31, 32, or 21 day cycle to something more irregular because your ovary, the egg count is dwindling. Ovulation becomes irregular. Some months you don't ovulate, sometimes you ovulate more than once. So your menstrual pattern becomes more irregular. Some people have a longer gap in between periods, while others have periods too close together or heavier periods. So it just changes in the pattern. And then you may start to observe other symptoms around fluctuating hormone levels. Like some people get most commonly hot flushes, which is due to dysregulation of your internal thermostats, your thermoregulation. It's not functioning as it should do normally because of estrogen fluctuations. So people get hot flushes. Hot flushes can make people have disturbed sleep. With disturbed sleep, people are irritable and tired during the day. They have mood swings. Some people start to forget things more easily. You have brain fog, memory issues. It can, excuse me, someone has helped me carry. Okay, fine. So All of this can obviously affect your relationships if you have a partner who doesn't understand what's happening. You just suddenly start to become irritable, moody, you're sweating all the time. And then there's the sexual relations part of it, where some people experience vaginal dryness, itchiness, low libido. So that, of course, affects sexual activity. Some people lose confidence because they don't feel themselves. So there's complaints of low self-esteem and just a lot of things. It can affect your home life, your work life, your physical health as well. Yeah.
So it seems, or it appears that menopause is a very extensive and a very significant change in the life of a woman. You mentioned relationship, you mentioned some mood changes. So could you tell us more about how menopause can affect a woman mentally, psychologically, yeah.
Yes. So, I mean, it's the same thing because a lot of women currently, even way before menopause, we know about premenstrual syndrome. So before you come up to your period of menstruation, and this is not for everybody, it doesn't apply to everybody because people regulate their hormones differently. Some women have quite extreme fluctuations in their hormones, and they can have impacts on their mood. Where they become moody, it's typically characterized by low mood or just a gloom feeling and a gloom period, in addition to the physical symptoms. So during menopause, it's pretty much a similar thing, but more permanent, leading to more permanent changes and more extreme. So people who have symptoms, because not everybody does, will typically have low mood, disinterest or lack of interest in sexual activity. They may have trouble concentrating, so they forget things at work. I've had a nurse who was actually she got into some legal trouble at work because she mixed up doses of medication, and it was really just going through perimenopause. So things like that. But it doesn't happen to everybody, and it doesn't have to be like that so as not to give menopause a bad name. It doesn't happen to
So
everybody.
it doesn't happen to everyone, and you said it doesn't happen to everyone in the same way.
Yes.
Okay, so women experience menopause differently.
Yes, absolutely. Some people have no symptoms whatsoever. So I believe typically people who, and this is just my personal belief, people who, just the same way some people never really know they're on a period until they literally see blood.
Okay.
Meanwhile, some others start to get signs of a coming period up to 1 week before because they feel bloated, they have pain, the moods are all over the place. So it's the same, I think. For some reason, we have all evolved differently, and some people do not get any symptoms of hormonal imbalances and things like that. I think the same people, you will carry on through your gynecological career if you tend to have more quieter flow through all of these changes. I think they are still the ones who end up having a very smooth ride through menopause. So the period just gradually diminish and they never really notice any other changes. Meanwhile, for some, they feel like they're a completely different person. Their relationships are breaking down, things like that, and they need help. That's why we have HRT, which is good.
Yeah. So what's HRT?
So HRT, simply put, is hormone replacement therapy. So it's a medical provision, basically, where we now have, thankfully, developed synthetic forms of the hormones your body naturally produces. Because when you go through menopause, so I'll start by saying estrogen is the key hormone in all of these changes. Estrogen is produced by follicles in your ovaries. Now, when you're approaching menopause, what happens is all of that follicular function, which is bringing up eggs every month, is all dwindling. So eventually, you're not going to have any follicular function at the end of menopause. That means also you're not producing as much estrogen as you were before. So by the end of menopause, you have a much lower level of estrogen hormone. Now, HRT simply seeks to replace estrogen so that you don't have or you have less symptoms of reduced estrogen.
Yeah.
But I would say naturally, people should come to a place where we were naturally made to not need estrogen beyond the menopausal age. That's how we were naturally made. But if you are experiencing a very exaggerated period of transition where your quality of life is really, really, really rubbish, then of course it would make sense that you need something to help alleviate the symptoms. So HRT is replacement of those hormones to help reduce the severity of the symptoms you're feeling.
Thank you very much for that. We'll still come back to that HRT. So do you think men, or do you think, men understand menopause? And do you think men support their women, or their, women in their lives enough to understand that some of those behavioral changes, irritability, might be due to menopause? And what do you think? Do men support their women enough?
So I don't have general information on this. I'm not aware of any population studies that have been carried out to give exact information. Yeah. But I think I can just extrapolate from how much support I have observed that women receive even before menopause, around the periods.
Yeah.
So, that is kind of a foreshadowing of what happens at menopause. But from what I can see, with how even that little snapshot of hormonal fluctuations tends to affect relationships, and the fact that even the women themselves don't always realize that the mood swings they're experiencing are due to the pre-period fluctuations. Yeah. Men also inevitably do not realize. I think for a man to know, usually the woman needs to know and be aware and then communicate. With all of the lack of information around menopause, I can only imagine that definitely there's a knowledge gap there for men and for women, but more for men. I would say.
So men might just think their wives are, their wives are changing and she's becoming irritable and quiet. Yes. I understand. Okay, so which means this topic is also very important for men. So men are more enlightened, and then when their wives or sisters or mothers or friends are getting through that, physiologic change, then they'll be able to provide that support. That's very good.
Absolutely, because it leads to divorce in a number of cases, actually.
Is menopause a sign of weakness? Or let me put it this way: if a woman comes to see you, the doctor, as a GP trainee, you're almost a GP. You should have been a GP if not for your kids and maternity. So if a woman comes to see you and she's talking about menopause problems or symptoms, you see it as a sign of weakness, or should anyone see it as a sign of weakness?
The fact that they're seeking help, or the fact that they're seeking help for it?
Seeking help and talking about it.
I mean, it's a natural phenomenon that everybody will go through. It's as natural as dying eventually. It's just a phase of life. Yeah. And so there's absolutely nothing wrong with talking, just the same way we talk about other health conditions. This is not even a disease. It's natural. It's normal. It's a normal phase everybody will get through to. And it marks an end of a reproductive career, which gives you a breather, actually, because now you're facing a new phase of your life where you can do a lot of things without having to menstruate every month and wear a pad every month. And you don't have to worry about the risk of getting pregnant with sexual activity. So I think it's a relief in a sense if people would see it like that, because there's been a lot of bad press around menopause because everybody talks about the symptoms. But we don't talk about the purpose of it. It's supposed to free you to a new phase of your life. You don't want to be having babies all your life into old age, because it ties you down to not being able to do more when you have young children. So it's a phase of freedom you're coming into. And I don't think there's anything wrong with talking about it at all, because it's natural. And I don't see it as a sign of weakness at all.
But I've never really thought about menopause from this light you just mentioned, the benefits and the positive lights of menopause. As you said, we've always seen menopause as a phase of decline, but we've never really seen it as a phase of strength and positivity, which is a very good way of viewing it. Yeah. So thank you very much for that. That has really broadened my scope, as regards menopause. Now, you said the average age in the UK is 51, and you mentioned 45 to 55-ish. So someone who is younger, if for instance a lady in her 30s begins to, is watching this video and is just wondering, could she be menopause from all the symptoms you mentioned earlier? Is it possible for someone that young to experience menopause?
There's something we call premature ovarian failure, which is where you get into true actual menopause before the age of natural onset, which would be below 40. There are many symptoms that could mimic menopause and are not actual cessation or onset of cessation of ovarian activity. You can have all of these fluctuations and you can have some of these symptoms and you're not going into menopause. And this happens only in very few or a little number of people, where they actually start to lose eggs, or the egg count really starts to come down to zero that early. It's very few people. It doesn't happen a lot, but yes, it can happen, and it's called premature ovarian failure. If you're in doubt, if you feel strongly convinced that you may be going through that, then I would say see a doctor, because then they would have to talk to you, examine you, get a history, and do some tests. At that age, you would need to go through tests because it's not natural for it to happen then. Normally, we don't have to test for it if you're at the natural age, but where we're in doubt, then we can test.
Brilliant. Thank you very much. So I think we've touched a lot on menopause. You mentioned, a lot of the symptoms a woman might experience that will give her a clue that she's in menopause. You talked about the positive light of menopause, freeing you to experience a new phase of your life, which is a very powerful way of viewing it. And you also talked about, premature ovarian failure. I want to ask something on HRT. How safe is HRT generally?
So, based off of the information we have, of course, I think anything manufactured or produced will have a level of risk with it. It's all about balancing risk and benefits, I would say. The goal should be that you go through your own menopausal period, gives you no trouble, and that you don't need any additional adjunctive treatments, and that you can just manage with lifestyle changes, exercise, diet, sleep, and all of that. I think that would be ideal. But we're saying for people who experience more severe or exaggerated symptoms that impact quality of life, impact relationships, even work, your self-esteem, your mental health, because some people have depression-like symptoms. So in that case, it would be sort of unfair to tell you to just rough it out, because your quality of life is quite poor, and menopause can last many years. The period going through menopause can take a couple of years. So for those group of people, of course, HRT poses more benefit than risk. There are risks with HRT because it's hormones, and you're stimulating your sexual organs for longer than you would naturally need to. So increased activity in your sexual organs or any part of the body increases risk of mutations. When cells are multiplying or more active than they should naturally be, there's a risk that you have one, misplaced or improper multiplication or division, leading to a mutation and then formation of cancer. So the risks around HRT are mostly with cancer of the sexual organs, but the risk is little, and it's even less with certain routes of HRT. So if you're having HRT applied through the skin as opposed to oral tablets of estrogen, through the skin is much less risk than oral.
Yeah.
But in any case, it's a risk versus benefit thing, and you just need to make it work for you.
Right. And if a woman is experiencing these symptoms but doesn't want the hormone replacements, I believe there are other alternatives that they can seek by speaking with their doctors. Is that correct?
So there are, first of all, there are many things you can do with your just changing your lifestyle that have a great impact on how you perceive your symptoms. Now, because of all the changes going on in your body, those produce a lot of stress. Half of the stress comes from not even understanding what's going on, what's happening to you. But then there's also adapting to the new changes. So what all of the lifestyle changes we advise you implement are geared towards reducing every kind of external additional stress and pressure. So we say, try to make sure you prioritize your sleep so you sleep better, so you don't have added irritability from lack of sleep. If you're having hot flushes and all of those vasomotor symptoms, get a fan, make sure your room is cool, make sure your bed is tidy, wear loose clothing. So try to reduce temperature as much as you can. Then eat a very good diet. This will be a good time to focus on a plant-based diet, because a lot of mood changes happen due to processed sugar actually in diets. And you don't want any of that added complication in addition to what your hormones are doing. So focus on a clean diet so you eliminate extra sources of stress. Communicate with your partner and those in relationship around you so they know how to support you and their attitudes do not worsen your problem, or their reaction to you does not worsen your problem. And, exercise, especially strength training exercise, things that strengthen your bones, your legs, and your core, because estrogen normally supports bone strength. When you have less estrogen, then you need to support bone strength through exercise and increasing calcium in your diet. So milk, yogurt, cheese, and things like that. So those are natural things you can do that definitely make a great impact. There are some other herbal medications, but we don't generally recommend those because they are not monitored, they are not standardized. We don't know what you're getting. We can't recommend it because it's it's a herbal thing, and the NHS or your drug regulation agency does not sanction it because they don't produce it. They don't know how much of the active ingredient is in each batch of stuff. It's not regulated. So it's a hit and miss thing. Yeah.
Right. I was still on HRT. This will be one of the last, if not the last question. How safe is HRT in resource-poor countries? And the reason I'm asking this is we know that even though the risk of cancers or blood clots is very small compared to the benefits usually, if this risk is suspected, or if a woman is suspected of having complications and there are not facilities available to investigate, does that then place her at a higher risk than benefits if we give HRT, especially in resource-poor countries?
So that is... It's a question on personal opinion, I guess.
Okay.
I would say in resource-poor countries, the most dangerous thing is lack of information and awareness.
Yeah.
If you have enough information to even get the diagnosis of menopause in the first place, and then you have HRT available to you, again, it comes down to risk versus benefits. So if you absolutely need it, then you need it.
Yeah.
And you can have it. The things, even in developed countries, the things we monitor for, I think, are easy to do and you should be able to do there. So things like checking your weights, checking your risk factors at every checkup or follow-up. You should be having follow-up in first place when you're on HRT. But then they would need to keep an eye on your blood pressure, your weight, check your smoking status, your risk factors. And all of those things are relatively easy to do, I would say. Now, it would help for you to know the symptoms of possible complications like a blood clot or onset of cancer. So, regular self breast examination is something you can do without resources. Learning what the signs of a blood clot requires does not need a lot of resources. I think information and awareness will empower you to make it safer so you can seek help if anything happens. But if you absolutely need it, then you need it, I would say.
So, dear viewers, you've heard from Dr. Theodora. She's giving us a lot of information. You've heard that menopause is not a disease, it's a normal process that happens at the end of or towards the end of a woman's reproductive career. It's not a disease, it's not something to be ashamed of, and it's not something that represents a sign of weakness. You should speak with your doctor and get the right help you need. So Theodora, thank you once again for enlightening us and enlightening the viewers, sharing your wisdom with us, and thanks again for honoring this invitation. Hopefully we'll have you on this platform again to share your insights on many other topics on women's health.
Thank you very much, Ma, for inviting me. I've had a good time. I've enjoyed myself. I hope your viewers get some useful information from what we've talked about. Thank you very much.
Thank you very much. Enjoy the rest of your day. Bye.